Hello everyone, welcome to Dentospedia, one of the trusted platform for simple, clear and high quality learning for various global dental board exam. And today I am going to give you a short lecture from endodontic module, that is the periradicular tissue. Why this chapter is essential? Understanding the periradicular tissue is extremely important because these tissues are directly affected in pulpal diseases. They determine how the teeth respond to any inflammation, and they also guide us in diagnosing the periapical pathologies. All endodontic treatment, they aim to protect and heal this tissue. So if you understand this chapter very nicely, you will find it easier to understand the conditions like apical periodontitis, abscess and cyst, and also the outcome of root canal therapy. So let us begin with the introduction. The periradicular tissue, which is also called periapical tissue. And from the name itself, peri means surrounding and radicular means root. So these are the tissue which surrounds the root of the tooth. So periradicular tissue, they are the supporting structures that surrounds the root of the tooth, including cementum, periodontal ligament, alveolar bone, and gingiva. And the component and the content of these periradicular tissues are firstly cementum. Cementum is a calcified tissue. They cover the root dentine and helps in the attachment to periodontal ligament fibers. So cementum, they are present on the root surface and they cover the root dentine, and these cementum, they provide attachment to periodontal ligament, while the periodontal ligament are the specialized connective tissue between the cementum and alveolar bone. So here alveolar bone are present and they are the specialized connective tissue between the cementum and alveolar bone, and they provide the support and sensory function. Now coming to alveolar bone is a part of the jawbone that forms and supports socket of the tooth. So alveolar bone, they are the most important structure which provides support to the socket of the tooth. While gingiva is the soft tissue covering the alveolar process, forming the protective barrier around the tooth. So gingiva is a soft tissue that covers the protective barrier around the tooth. Coming firstly to the cementum. Now cementum is a calcified avascular connective tissue that covers the root dentine. It provides attachment for periodontal ligament, especially the Sharpie fibers. These Sharpie fibers are very important from exam point of view. They are the terminal ends of the fibers which are seen in the periodontal ligament. We are going to discuss the Sharpie fibers in detail, and they plays an important role in tooth support and repair. So here from the diagram we can see the cementum that covers the root dentine. Coming to the origin, they are originated from the dental follicles, and we have discussed this in detail in our embryology chapter. Coming to the composition, they have 40 to 50% of the inorganic material which are present in hydroxyapatite crystal form, and 50 to 55% organic and water. Now it is very important to learn this composition detail by percentage from the exam point of view. They are avascular and it does not perform any remodeling, unlike bone, because the bone performs remodeling. Now the cells of the cementum deposition occurs in a pattern of the growth line, and these pattern of the growth line, they are represented as incremental lines of Salter. So it is very important to remember Salter is for cementum. Understand? Now the cemento-enamel junction, this shows three type of relationship. There is cementum when overlaps the enamel. It is seen in 60% of the cases. Okay. Edge to edge, it means the cementum is attached to the enamel, but they meet edge to edge, they just meet to each other, which is seen in 30%. And if there is gap, that is the 10% which exposes the dentine, that means the cementum and the enamel, they fail to meet each other and there is a gap created in between. And there is cell of the cementum which is known as cementoblasts and cementocytes. Coming to the functions of the cementum, The function of the cementum is to provide anchorage via the attachment of the periodontal ligament fibers. They also perform protective or the reparative function because they help in the reparation of the root resorption and covers the dentine, hence providing them protection. Adaptive, they also compensate for any wear and eruption, and hence they protect the dentine. Sealing, because they protect the dentinal tubules, and that is also regenerative function which aids in reattachment after injury. So main function of the cementum is to provide anchorage and protection. Here are the three CEJ relationship we can see and in the diagram. This is enamel, this is cementum, and we can see there is overlapping between cementum and enamel, which is seen in 60%. While here the enamel and the cementum, they just meet their edge to edge, and it is seen in 30% of cases. While here the cementum and the enamel, they have gap, and it is seen in 10% of the cases, and which this gap exposes the dentine inside, and due to which the dentinal hypersensitivity increases. So suppose any stimuli coming nearby to this area, the dentinal sensitivity aggregates and the patient feels pain. Coming to cementoblast. Cementoblast, they are the formative cells of the cementum. They are derived from dental follicles, and they are located on the surface of the cementum towards the periodontal ligament site. So they are present on the edge of the cementum. So this is the cementum. Those cementoblasts are present on the edge of the cementum towards the periodontal ligament. The main function is to secrete cementoids. This is important, which is the organic matrix which later mineralizes to form cementum. They are also responsible for cementum repair after resorption. They are shaped as cuboidal or the flattened cell, and they become cementocytes when they are entrapped in the matrix. So where they are entrapped in the lacunae, they become cementocytes. Coming to cementocytes, the cementocytes, they are the entrapped cementoblast within the mineralized cementum. So lies in the caniculi, they are connected by caniculi, and which opens towards the periodontal ligament, allowing the diffusion of the nutrition. So we can see here the lacunae is present, and these cementocytes are the cells which are entrapped. Cementoblasts are entrapped inside, and here we can see they lie in this lacunae. They are connected by caniculi, and then they run towards PDL. They open towards the PDL, which allows the diffusion of the nutrition. Their main function is to provide vitality of the cementum, and more in common in the cellular cementum they are present. We are going to discuss this cellular cementum in detail later in the chapter. Thank you everyone. Thank you to understanding and your cooperation. It was a brief and clear overview of periradicular tissue, an essential foundation of understanding all endodontic disease. To learn the full chapter with diagram, flowchart, essential clinical correlation, and exam-oriented MCQs, download the Dentospedia app today. Thank you.